it safe if you don't tie your mask all the way.
And if you've already tested negative for COVID-19, should you get tested again? Dr. Mallika Marshall has the answers to some of your coronavirus questions.
PJ on Facebook writes, curious to know if all of the people dying from COVID are able to donate their organs. PJ, unfortunately, people who die while testing positive for COVID-19 are not eligible to donate their organs, which, as you can imagine, has put a real strain on organ donation here in this country. Our next question comes from Marilyn, who writes, I'm 79 in good health and tested negative 2 months ago. How soon does it make sense to be tested again? Marilyn, if you're feeling well and you don't think you've been exposed to someone with the virus, for example, you don't necessarily need to be tested again unless you plan on traveling out of state or plan on visiting with others. John from Ontario writes, what constitutes a wave of the COVID virus? And if a second wave, why not a third and fourth wave? John, a wave is a peak in cases followed by a significant drop. And while certain parts of the country, like including here in Massachusetts, we have seen a significant decline in cases, other parts of the country are seeing big upswings. And so the thought was that we would have a first wave and then a decrease in cases, and then in the fall and winter, we'd see a second wave. But for some states, they may not see a decline in cases in order to have a second wave. In terms of third and fourth waves, I think the hope is that we'll have a vaccine or effective treatments that'll keep big peaks of cases from happening in the future. Our next question comes from Karen, who writes, I see many people wearing masks that have two ties behind their heads. Many are just using the top ties and the bottom ties are not tied. Is this safe when around other people? So the mask really should sit over the nose and up under the chin. And chances are if the bottom tie is left untied, it's not sitting securely below the chin. So it's really not preventing that person's respiratory droplets from escaping, and it's also allowing other people's respiratory droplets to get in.
Thank you, Doctor. Dr. Mallika offers her best advice, but as always, consult your personal doctor before making any decisions about your health. If you have a question for the doctor, there are 3 ways you can reach her. First, her email, drmallika@cbs.com. You can reach her on Twitter @Mallika Marshall, or you can Facebook message her, Dr. Mallika Marshall.